Hi, Respiratory Therapy faculty. My name is Jackie, and I am super excited to share my journey of becoming a respiratory therapist. I am a married mother of two adorable boys, Ari, who is 5, and Avery, who is 7. I have been working at Franklin Square Hospital for the past 12 years and as a certified nursing assistant for 10 of those years. As a certified nursing assistant, I have learned much about patient care and compassion. Some of my duties include bathing, feeding, taking vital signs, answering call lights, documenting, and rounding on all my patients every 2 hours. I love my job, and I am proud to say that I was nominated for Certified Nursing Assistant of the Year 3 times. Although I didn't win, I felt honored and appreciated by my peers. However, everything changed when COVID 19 hit. I saw how respiratory therapists were working tirelessly to save lives and help people breathe. I was amazed by their skills and dedication. I also realized that I wanted to do more for my patients and learn more about the respiratory system. Taking the initiative and following my heart, I changed my major from the RN program to the respiratory therapy program. In doing so, anatomy and physiology was up next for me to take at CCBC in the spring of 2022. It was a challenging but rewarding experience that confirmed my passion for this field. I learned so much about the structure and function of the lungs and how they interact with other organs. I also discovered that I am meant to do this for the rest of my life. So, why would I want to become a respiratory therapist? I learned that a respiratory therapist is a critical healthcare professional who specializes in treating patients with breathing problems caused by various diseases or injuries such as asthma, COPD, and now COVID. They work in hospitals, clinics, nursing homes, or home care settings. They administer oxygen therapy, monitor ventilators, educate and demonstrate to patients how to use the devices that they need to help them breathe on a daily basis, such as CPAP and BiPAP machines. They collaborate with other healthcare providers and are also trained to respond to emergencies such as cardiac arrest. The big question is, why would I, Jaclyn Shockley, be a great respiratory therapist? It's because I have a passion for helping people in difficult situations. I have been studying hard to learn all the skills and knowledge needed to provide quality care for patients over the last 10 years. I am also compassionate, I am friendly and reliable, and that makes me a great team player and a wonderful person to work with. I'm ready to take on any challenge and make a positive difference in the lives of the people I would care for and the professionals I would support. Lastly, we all want a cohesive work environment where we can collaborate and support each other. Sometimes we may have disagreements with our coworkers, and that's okay, but we should always try to resolve them in a respectful and constructive way. One of the tools we use on our hospital floor is RAP, which stands for Recognize, Accept, and Plan. This tool is typically used to address the patient family members. However, in a learning setting, similar tactics would apply. I would first acknowledge their feelings and thoughts, accept them without any judgment, and make a plan to deal with them in a constructive way. Identifying the source of the conflict and trying to understand the other person's perspective is key. With no resolution, the most constructive direction would be to engage the instructor in mediation. And finally, it is an honor to be considered for this great program. I look forward to the next steps. Thank you.